Good afternoon, everyone. Let me share the slide. Yeah. So today I will be talking about principle of exercise prescription and a little bit about kinesiotherapy as a part of the interventional clinical physiology. And I am Dr. Hanjaban Barun Sharma, and I am a sports and exercise medicine specialist as well as medical and clinical physiology. I am from IMS BHU and currently the president of Indian Society of Sports and Exercise Medicine. Let's begin the talk. So, as a part of the interventional clinical physiology, sports and exercise medicine is an integral sub-branch where we deal with sports medicine as well as exercise medicine. And in this talk, I will be focusing on exercise medicine, where we use the physical activity and exercise for the promotion of the health and fitness, as well as for the prevention, treatment, and rehabilitation of different clinical, conditions, clinical illness, as well as injuries by using the component of the exercise medicine. Other sub-branch of the interventional physiology is functional medicine as well as lifestyle medicine. In functional medicine, we basically target the root cause of the different symptoms, and also in a lifestyle medicine, we target different disorder of the lifestyle by using different physiological intervention, be it a nutrition or it may be sleep, it may be exercise. And we use this different physiological intervention, including rehabilitation before prescribing, the pharmacotherapy as well as surgery. That's why this functional lifestyle and exercise medicine is extremely important, and it forms the future of clinical and interventional physiology. Going ahead with my talk, I will be focusing on exercise medicine, mostly on physical fitness, physical activity, and I will be talking more on movement. Why movement? Because movement itself is related with the evolution of the human being as such, and because we all human being evolved, Homo sapiens evolved in the plain of Africa, savanna of Africa, as an endurance runner or endurance walker, where we work for a very long time, where we were basically what you call the persistent hunter, and our brain, or complex brain, is evolved to produce adaptable and a complex movement. That's why movement is extremely important. And if we are not doing movement, then we are basically going against our evolution, and that's why so many cardiometabolic and non-communicable diseases are associated with physical inactivity. And this is one of the documentary which we make regarding exercise and brain health. And brain health is extremely important, as far as insulin associated glucose uptake is concerned. And Alzheimer has been recently known as type 3 diabetes also. The importance of the physical activity for prevention of the different cognitive decline and different what you call the mental illness associated with type 2 diabetes is important. One has to incorporate different physical exercise and physical activity intervention. Going ahead with exercise, because exercise is medicine. One has to know that there are so many different aspects of each and every organ or each and every part of our body is affected positively by exercise. Be it the beta cell of the pancreas, where the functioning of the beta cell is improved with improved insulin sensitivity. Liver, there is increased insulin sensitivity, gluconeogenesis, glucose uptake is increased, fat oxidation is increased. There is ectopic fat deposition in liver is decreases, and insulin clearance also affected, where VO2 max or aerobic fitness is increased, resting heart rate is decreases, and different blood pressure also decreases. There is decreased insulin resistance, decreased incidence of the type 2 diabetes and non-alcoholic fatty liver. It also decreases in adipocyte tissue. Also, there is increase in insulin sensitivity, glucose uptake, triglyceride mobilization, and itself associated with a decreased adipocyte tissue, especially on the dangerous, visceral adipocyte tissue in the muscular muscle. Also, there is increase in muscle mass. There is increase in insulin sensitivity. Glucose uptake is oxidative, mitochondrial fitness is increases. Mitophagy also increases, and and different fusion and fission of the mitochondria, which are associated with different health, especially the fission, which are associated with healthy mitochondria, and there is increased fatty fat oxidation. There is decrease in ectopic fat, triglyceride, fat deposition in what you call muscles, as well as there is decreased storage of the ceramides and lipid toxicity, lipotoxicity. All this decreases by exercise. And in the blood vessel, we can see that there is increase in the blood flow is there, vasodilation is there, nitric oxide response is increases. There is increased muscle membrane permeability, the transport of the different oxygen as well as the fatty acid for utilization. All this thing is affected by exercise, where in the whole body we can see that there is increase in aerobic fitness, muscular fitness, and different fitness parameter. We can see that there is increase of additive capacity, insulin sensitivity is there, or triacylglyceridemia is decreases. And there is a decrease in cardiovascular disease, metabolic syndrome, obesity, and mortality and morbidity. All this is affected by exercise, and that's why exercise is has been prescribed as one of the most important and the most effective medicine. And that's why American College of the Sports Medicine, in association with the American Medical Association in 2007, they launched exercise is medicine movement, which is basically the global movement to make physical activity in a medical care, where physical activity is made an important part of health promotion, prevention, and treatment of different medical conditions. And it was launched globally in 2010. In India, our society, in association with different other society under American College of Sports Medicine under EIM, we are about to launch exercise is medicine India, a national center, very soon, in probably in 2022, early 2022. And we can see that exercise is associated positively with so many important disease reduction as compared to drug and surgery. Even also, like for example, type 2 diabetes, there is a 58% incidence reduction by exercise, whereas drug or surgery, especially metformin, there is 31% reduction is there with metformin. So different different cardiometabolic illness, as well as including the different cancer, are benefited by exercise. That's why exercise is extremely important, and one has to know the proper way of prescribing exercise. Just like medicine, just like different surgery, you have to know the proper technique, proper way of prescribing exercise also. That's why exercise prescription, knowledge of exercise prescription is extremely important. Going ahead with the metabolic fitness and diabetes, the burden. We all know that diabetes is reaching a pandemic proportion all over the world, with currently 463 million adults worldwide. They are suffering from diabetes, and by 2045, 700 million worldwide will be suffering from diabetes. And most of the diabetic, they are type 2 diabetic, that is 90 to 95% maybe type 2 diabetic, and mostly are associated with obesity and overweight. That's why it is also known as diabesity. And both pre-diabetic and type 2 diabetes, they are associated with a insulin resistance. And just like I have said it, from 2019, from 463 million to 700 million by 2045, there may be 51% increase in type 2 diabetes. And that's why we have to be very careful, and we have to start acting right from now, because the situation is not so good. And if you see, by International Diabetic Federation, data from International Diabetic Federation, we see that the China and India, especially in India, 700 million, they are suffering from, type 2 diabetic. This one has to understand. And for the future also, if you see, for example, the Southeast Asia countries, then from 87.6 million, it has been, in up to in 2045, from 2019, there may be 74.7% increment may be there in case of the Southeast Asia. And for Western Pacific also, there may be an increase for 30.5%. And for Middle East and North Africa also, 96.4% increase may be there. That's why we have to understand this problem, and we have to start acting now, targeting the root cause for type 2 diabetic and the metabolically abnormalities. And that's why we have to know certain point regarding the metabolic fitness. Like for example, metabolic fitness has been under metabolic fitness, different parameters are concerned. Like for example, waist circumference should be less than 102 centimeter or 88 centimeter for male and female respectively, or fasting glucose less than 100 milligram per deciliter, or SbA1c less than 5.7%, or blood pressure, yeah, systolic less than 120, diastolic less than 180 millimeter of mercury, triglyceride less than 150 milligram per deciliter, or HDL, it should be equal to more than 40 or 50 milligram per deciliter for male and female respectively, and there should not be any related medicine intake should be there, and these are basically concerned considered for the definition of the metabolic fitness. And by using this definition, and recently, it has been reported that 88% of the US adults are metabolically unfit. And one important point which one has to consider is also the fasting, serum fasting level of the blood insulin. And the fasting of level of the insulin should be less than 66 micro unit per ml. It should be there. And in order to exclude the condition of the insulin resistance, where blood sugar may be normal, blood sugar is mostly normal, where but there is a condition of the hyperinsulinemia where insulin level is high. So the one can consider the fasting insulin level also, and if one is able to do HOMA IR, measuring different insulin resistance, then that is also fine. So these are the different parameters which one can easily consider in order to see whether a particular person is metabolically fit or not. But the point to be remembered is diabetes is reaching a pandemic proportion, and India is becoming a diabetic capital, and we have to act now. Otherwise, the problem is becoming very, very, very serious. So going ahead with the fitness and diabetes, this was one of the study which we have done in 2016, where we compared different aerobic fitness parameter like HRR, that is heart rate recovery in 1 minute, heart rate recovery in 2 minutes, or VO2 max, that is aerobic fitness, by using 6-minute walk test. We have compared between diabetic, type 2 diabetic males and control, that is healthy control. And as usual, we find that these aerobic fitness parameter are significantly lower in case of diabetic, type 2 diabetic. But this is not so surprising, because the type 2 diabetic also has significantly higher percentage body fat or waist circumference or waist hip ratio, which basically tells about abdominal obesity. But the point to be remembered is when we control the differences in percentage body fat, waist circumference, waist hip ratio, the significant difference disappear except VO2 max. That is, VO2 max was significantly lower in type 2 diabetes over and above the differences in percentage body fat, waist circumference, or weight hip ratio, that is independent of the differences in obesity. VO2 max or aerobic fitness may be a significant parameter for type 2 diabetic. That is important. So fitness is important. Not only obesity, fitness is also very important, especially cardiorespiratory fitness, as shown by this graph. Another one is the importance of the abdominal obesity, especially visceral waist circumference or waist height ratio. Here we can see that if we see the ROC curve, this was a study which we done in Banaras, Varanasi population, for female n equal to 53, and we see that the cutoff for waist circumference was 93.5 centimeter for having abnormal random blood sugar level of equal to more than 140 milligram per deciliter. For waist height ratio in those female, we found that the cutoff was 0.596 for having there is random abnormal or increased random blood sugar that is more than equal to 140 per second. That's why abdominal obesity, etc. is important. Another important point one has to remember that resistance training is also extremely important for diabetes, especially if you see this graph study where it was done in nine men, type 2 diabetic here in published in 2005. Here you can see that the total abdominal fat was significantly reduced after 16 weeks of training. And there was reduction of the 10 to 11% reduction in total abdominal fat was there. And if you see the insulin sensitivity index, it was 46% increment was there in insulin sensitivity by incorporation of the resistant training. So aerobic fitness as well as resistant fitness, muscular fitness is extremely important as far as type 2 diabetic is concerned, as far as diabetic is concerned. So going ahead with the exercise lifestyle and diabetes, here you can see in this a graph where different comparison of comparison for percentage reduction diabetes incidence was done. Comparison with placebo or metformin or lifestyle was done. For example, if you see in this group of equal to more than 60 years, you can see that the lifestyle intervention as compared to metformin was very effective in order to in reduction of the what you call the diabetes incidence. Also, lifestyle in compared with the placebo also was significantly has significant effect as far as reduction in diabetic incidence was concerned. Similarly, for 45 to 59 years, the lifestyle was better as compared to placebo, and lifestyle was still better as compared to metformin again. Metformin again, but however, metformin was little bit effective. If we see as compared to lifestyle, if we see younger population, that is 25 to 44 years, and here the overall reduction by intensive lifestyle intervention in type 2 diabetics was 58%, and metformin reduced by 31%. And the goal of the lifestyle intervention they have done is the reduction of the at least 77% of weight reduction by using healthy low calorie they have used low fat diet here. And moderate they incorporated moderate physical activity like brisk working for at least 150 minutes per week. And here what they have shown is the for every kg reduction in weight, the incidence of the diabetes, the risk of diabetes decreased by 16%. But one has to know that the insulin action was increased irrespective of whether there was weight loss or not, by using different exercise, dietary changes, even without weight loss. Also, the insulin sensitivity was, increased. This is important. Again, here, if you see this graph from 15 up to the followed for 15 years, after DPP. DPP is nothing but diabetes prevention program with intensive lifestyle intervention. DPPOS is DPP outcome study with access to all the participants are access to lifestyle intervention education. And here you can see that at the end of the 15 years, lifestyle has maximum reduction in the risk of type 2 diabetes. That is 27% risk reduction, by lifestyle intervention, whereas metformin causes a reduction of 18%. That is after 15 years after the initial enrollment of the subject in DPP. So that's why lifestyle intervention in the form of the exercise, as well as proper dietary changes is very important. And there is, although they have used low fat diet, but healthy high fat low carb diet has been increasingly popular as far as metabolic abnormality including diabetes is concerned, and many trials are recently being conducted showing efficacy of that also. One has to keep that in mind also. And if you see this graph, you can see that this is this study was done in 33 type 2 diabetic males, where intervention was done for 14 weeks. If you see that this is a visceral adipocyte tissue, and visceral adipocyte tissue was significantly reduced by diet plus exercise and exercise alone. That means diet alone doesn't cause a significant reduction in visceral adipocyte tissue. So if your aim is reduction of the visceral adipocyte tissue, then you should add on exercise. Here in this case, they have added aerobic exercise. but aerobic, and different exercise component, aerobic exercise, resistant exercise, ability, balance exercise, all these things you have to incorporate, and you have to do a holistic approach, especially if your aim is a reduction of the visceral adipocyte tissue. A visceral adipocyte is the one which is having the most abnormal metabolic effect. Subcutaneous, the fat is relatively inert as compared to the visceral tissue. And here again in this study which they have done is for they have basically done for hazard ratio for type 2 diabetic diabetic development, and for they have followed for 12 years, and what you can see that there is a reduction in hazard ratio for the development of type 2 diabetes by different, like lifestyle, lifestyle by using lifestyle intervention. And here you can see that the reduction was greatest for those n equal to 1338 a person where baseline physical activity was low. That means for those person who are having lower baseline physical activity, the reduction in hazard ratio for the development of the diabetes was more. That means nothing is left. You can start doing exercise immediately now also, no problem. And because if someone who is extremely fit and developing diabetes, then the development of diabetes may be because of some other reason. But if you are physically unfit, and if you start exercise fitness and exercise and positive lifestyle, then you will be having more beneficial as compared to someone who is already fit and developing diabetes. This is the thing which you have to remember here. Is the same thing here also. For baseline physical activity below than goal is nothing but 150 minutes per week, and the reduction in hazard ratio was maximum here. Same here also. The reduction was maximum for those having a baseline physical activity lower than goal. That is important. So those person who are having sedentary activity, if they incorporate some exercise and positive lifestyle, then the benefit will be very, very high. So going ahead with the exercise, regime, as we all know that exercise, the purpose of exercise is improvement or maintenance of the physical fitness. One has to know the different component of physical fitness, like there's health-related component, including the cardiorespiratory fitness or VO2 max, like running or jogging, all this stuff. Body composition, where we aim for reduction of percentage body fat, especially the visceral fat, and there is increase in lean body mass, muscular strength, muscular endurance, flexibility. You have to understand in case of the diabetic also, skeletal muscle system is affected by diabetic, where glycation of the different protein is there. Because of that, inflexibility or decreased flexibility, decreased range of motion may be developed in different joint and different musculoskeletal abnormality may develop. That's why muscular fitness is also important, especially in case of the diabetic. You have to incorporate also skill related physical fitness component also. You have to incorporate, like it may be agility, coordination, balance, power, reaction time, and speed, not only for the sports person but also for a special subgroup, like for example elderly. You have to incorporate the balance and coordination training in case of the elderly who are very much having this high incidence of the sarcopenia or sarcopenic obesity. And by incorporating the training for balance and coordination, you will be preventing the risk of falling. So in this way, you have to target different component of this physical fitness by designing different exercise regime, the different exercise program, targeting each and every segment which you want to improve. So that's why the knowledge of different component of the physical fitness is extremely important. Going ahead with the exercise prescription, before going into the detail of the exercise prescription, you have to understand the principle of the exercise training also. Like exercise training, one can understand by using by following this word that is SPORTY, where S is stand for specificity. That means each exercise training has to be specific for that particular component of physical fitness which you want to improve. Progressively, it has to be progressively overload, because you have to keep on loading your physiological system accompanied with adequate recovery, so that positive physiological adaptation may be there. And if you stop giving that particular adequate stimuli, then what will happen? Detraining will happen, and you may lose all majority of the benefit which majority of the positive physiological adaptation which you gain through exercise. So that's why you have to avoid keep on progressive overload should be there, where if decreasing the effect of the detraining. Then another important point is the exercise, different component of the exercise, that may be volume, it may be intensity, it may be technique, has to be varied depending upon which phase of training which you are going on, depending upon different time interval. This is the principle of the periodization. Another important principle is the individuality, where you must understand that each individual person has his or own a special a specific individuality. Adaptation is there. One may be high responder, one may be a little bit less responder, and you have to give a little bit higher exercise load in order to have achieve same physiological adaptation. So that's why you have to consider the principle of individuality. One size doesn't fit for all, and you have to do one-to-one interaction with your client, and you have to design the exercise program in such a way that, and this table is nothing but what we had, what we use in case of the player, where we use different technique like testosterone by cortisol ratio, or HRV like a natural logarithm of RMSSD, or different parameters which we use in order to detect whether overtraining is there or not, where how much over progressive overload we can do safely. So these are the different parameters which we basically use in case of the player. Another one is the importance of the principle of the exercise prescription, where we follow the principle of the fit VP, where F is a frequency, frequency, how much, how many times, or how much frequency we have to give the particular exercise, it may be per day or per week or so. Intensity, how much intensity do we have to give the exercise, or for how much duration, what may be the type of exercise, maybe aerobic, resistance, flexibility, balance, or other type of the exercise. Volume is nothing but the frequency into intensity into time duration, that is the volume, that is the total exercise load. And it has to, and everything has to be progressive. It may be depending upon the different uh, regime. You can do a pattern and progression of the exercise. You can do it, may you may follow 10% rule, increment in 10% increment in 10 days, or or per week or so, depending upon 5 to 10%, or depending upon your clinical practice, as well as the adaptation by the client, as well as the status of the client, fitness status of the client. So this, by following this principle, you have to individualize, and you have to prescribe, you have to design an exercise protocol targeting each specific component of the physical fitness, which we have already discussed. So this is basically the aerobic part, this is the resistance part, this is the flexibility part, and this is the balance part. So one has to understand different each different type of the exercise. Going ahead with the basic exercise physiology, since we have talked about the intensity of the exercise, it is very important that one understand the intensity of the exercise. Intensity of the exercise can be, for aerobic exercise, it can be done by using different component, like for example, HR max, where HR is the maximum heart rate achievable depending upon the age. It is calculated simply as 208 minus 0.7 into S in air, and depending upon its percentage, exercise can be divided into very light, moderate, vigorous, or near maximum, that is 57, 64, 76, 96, 96. In case of the diabetes, what is happening is, because of the diabetic neuropathy, autonomic neuropathy, we may not rely on the heart rate. So diabetes, we basically use the RPE, that is rate of perceived exertion, where the scale is from 6 to 20 scale, and depending upon which score done by the particular client, exercising client, the exercise can be classified into very light, moderate, vigorous, or near maximum, like 9 to 11, 12, 13, 14, 17, or 18. In case of the resistance training, also it is done depending upon the one percentage 1 RM, where 1 RM is basically the amount of the weight which you can lift just only one time by maintaining all the form, that is 1 RM, and percentage of the 1 RM you can classify your resistance training into light, moderate, very light, moderate, vigorous, and near maximum, like 30, 50, 70, 85, 85. So that you have to understand. And for a normal person, depending upon HR max, also you can approximately know which energy system you are targeting. It may be aerobic, it may be anaerobic, it may be anaerobic ATP or phosphagen system, depending upon heart rate. Like for example, aerobic is basically targeted where you are doing exercise at an intensity of approximately 55 to 60 to 90% of VO2 max, or it can be HR max, or it can be VO2 max like 40 or 50% to 85% of VO2 max. Now this VO2 max can be converted into more practically HR max, because HR max by using different easily available, marketly available wristwatch or heart rate monitor, you can easily prescribe exercise. But VO2 max is a laboratory scientific parameter. So practically VO2 max person can be converted into HR max by using different method. That is one of the method is a carbonate method, where by using this formula, we basically can convert the percentage VO2 max into HR max, and it can be used. Like for example, warm up 40 to 60% of VO2 max can be converted by using this carbonate method approximately into percentage heart rate, and we can practically use. So this is important, and if you want to know details, all this is mentioned already in the chapter which I wrote, for EPG Patsala in by the name of the sports physiology. It is freely available in the website of the UGC. One can always go there, and detailed reading can be done. So before going into the exercise prescription, one must know, whether a particular person is having high risks for exercise related abnormalities or not, or there may be a certain complication may arise if you do exercise in a high risk patient. So one has to understand whether a particular client is in the high risk or not. Afforded freely available 2021 per physical activity readiness questionnaire, plus is a self-directed questionnaire. And there are other questionnaire also especially for healthcare provider and doctors, and you can easily fill and see whether a particular person is at high risk or not. Or you can follow different algorithm, like for example, in case of the diabetic, who are the diabetic who are having the kidney problem. If there is a non-cardiovascular diabetic or kidney problem, if they are asymptomatic, then medical clearance may be recommended, and following medical clearance, they basically can do light to moderate intensity exercise. But for all practical purpose, one has to understand if HbA1c and if the glycemic control is normal, if there is no symptom, there is no complication in type 2 diabetic or type 1 diabetic, uh, for mild to moderate exercise can be started, and for having vigorous or high intensity exercise, then medical clearance is always it's always recommended. And if there is any sign and symptom for cardiovascular, metabolic, or renal disease regarding of the status of the disease, you have to get medical clearance. So all these things one has to understand. And if a particular person, client is diabetic and already they are doing regular physical activity, and they are asymptomatic, but they have metabolic and renal disease, then physical clearance, for moderate intensity may not even be needed also. But one has to be very, very careful, and one has to different follow the different algorithm. And this is not the only algorithm. There are also other algorithm, like this is a easily available algorithm which you can stick in front of your gym or your exercise room, where the client or yourself can see and decide whether a particular person is fit to do exercise or some medical clearance is required or not. But the bottom line is, detailed physical examination and the history as well as 12 lead ECG may be required, and depending upon the finding, you may further go up in different investigation, like it may be exercise stress test, or it may be echocardiography, or it may be cardiac MRI even associated with lead gadolinium enhancement, depending upon your requirement. So this one has to. So in case of the diabetes, there are a certain specific assessment one can do. For example, cardiorespiratory cardiovascular disease is highly prevalent in case of diabetic. They are very much high risk of having this cardiovascular disease, and that's why a different regime are there. Different full history and examination one has to do. And if there is autonomic neuropathy present, then full cardiorespiratory assessment is always recommended and one has to do. Another is if there is a peripheral neuropathy is present, then weight-bearing exercise should be avoided. In case of the active foot disease or more severe, if there is a more severe neuropathy is present or not. But moderate intensity, may not, increase the risk, and you can a little bit modify the exercise, and you can slowly give the exercise of mild to moderate intensity. But weight-bearing exercise, you have to be very, very careful when there is an active neuropathy with foot disease present. Another is a retinopathy. In case of the presence of the retinopathy, you should be very, very careful to avoid all vigorous exercise, especially in context of the proliferative or severe non-proliferative retinopathy, like for example exercise which increases the systolic blood pressure of say equal to or more than 170 millimeter mercury, you have to avoid. So one has to clearly understand what are the risk factor for if retinopathy is present. And for neuropathy, nephropathy, there is no such evidence by now that there is any specific exercise restriction or modification is required. But one has to understand that you can always start mild exercise, and then depending upon the condition of the clinical condition as well as physical fitness as well as adaptation of the patient, you can slowly increase into mild to moderate. And for vigorous also, depending upon the requirement, you may add even add vigorous no problem. But one has to be very, very careful. So this is important. And blood sugar, we will discuss more detail about the blood sugar, what should be the blood sugar, and how we have to take. For example, if the blood sugar is less than 5.6 millimole per liter before doing the exercise, pre-exercise, then you can give certain extra carbohydrate. If your exercise is prolonged or severe, and morely aerobic exercise, one has to understand is that because. And in certain exercise are high intensity exercise, they are known to cause high blood sugar, and there is always risk of ketosis also. One has to understand all these things. So that's why you have to keep in mind the different different points which you have to remember, especially in case of if you are dealing with diabetic. For example, you must understand the basic physiology of variability in a blood glucose as in response to different type of exercise. For example, aerobic exercise. Aerobic exercise is generally associated with decrease in blood sugar. But however, if you see anaerobic exercise, high intensity resistant training, all exercise which is high intensity, they are mostly associated with increase in blood glucose level. And if you do mixture of aerobic and some anaerobic exercise, or high intensity or mild to moderate exercise, then the response in the blood sugar may vary. This is basically for type 1 diabetes. So hypoglycemia and hyperglycemia both are the risk factor one has to consider. And hypoglycemia, especially for aerobic exercise, for example, single aerobic exercise may causes increased activity of the insulin up to say 2 to 72 hours. And hypoglycemia, one may suffer hypoglycemia. You have to check for immediate hypoglycemia risk as well as for late hypoglycemia risks, like if you do evening aerobic exercise, evening aerobic long prolonged exercise, then it may lead to nocturnal hypoglycemia. So nocturnal hypoglycemia risk is there. So one has to understand all this thing, and depending upon that, you have to adjust your different diabetic medicine, including insulin. And another one which you have to understand is hyperglycemia. Hyperglycemia may happen especially in case of the intense brief physical activity. It may be because of the different counter regulatory hormone, norepinephrine, epinephrine, glucagon, cortisol, and growth hormone. These are the different counter regulatory hormone. Because of that, there may be increased blood sugar level may be there. That's why there is also risk of ketosis. One has to understand this thing. But the point is, in long time they are beneficial, but short time they may slightly increase blood sugar, especially the resistant exercise. So resistant exercise, if done intensely, it may slightly increase the blood pressure, your blood sugar, but in long time it is highly beneficial, and one has to understand. So the point is, since exercise has physical activity and insulin has additive effect, and you have to understand certain point, like for example, if your blood sugar, pre-exercise blood sugar is less than 100, then and if you are doing low physical activity, say half an hour, then 10 gram of carbohydrate in the form of a small fruit, bread, biscuit, or yogurt or milk can be added. If it is more than 100, there is no need to take any kind of extra food. If you are going to do moderate intensity, say for example 1 hour, if your blood sugar is less than pre-exercise blood sugar is less than 100 milligram per deciliter, then 20 to 30 gram of carbohydrate may be added. And if it is 100 to 180, 10 gram may be added. And if it is 180 to 300, no need to add. And if it is more than 300, then it's always preferable to avoid exercise, because the blood sugar may go higher also. And if the rule of thumb is, in case of type 1 diabetic, we generally avoid exercise when the blood sugar is more than 200 to 250 milligram per deciliter with ketone, if urine ketone is present, or if it is more than 300 milligram per deciliter, irrespective of whether ketone is present or not, we generally avoid exercise. And exercise is generally preferable when pre-exercise blood sugar is around 120 to 180 milligram per deciliter. And we have to, since physical activity and insulin and other drugs has a additive effect, you have to modify your medicine. Like for example, in case of the insulin, in case of the mild aerobic exercise, say 25% of the VO2 max for say 30 minutes, then insulin, baseline insulin reduction, 25% of the dose reduction can be done. And if the exercise duration is say 1 hour, then up to 50% of insulin dose reduction can be done. In the same way, for heavy aerobic exercise, say 70 to 58% of VO2 max for exercise duration of 30 minutes, then up to 75% reduction in dose of the insulin can be done. So that's why this is the reduction in the what we call the bolus insulin dose before exercise, depending upon a different exercise regimen. So and not only insulin but also other insulin secretagogue drugs, like sulfonylureas and others, which increases the secretion of the endogenous insulin. So you have to understand, you have to modify the dose of the medicine in order to avoid the problem of the post exercise hypoglycemia. And accordingly you have to add blood different easily digestible the carbohydrate source. Like for example, if you are doing strenuous activity for 1 to 2 hours, and if your blood sugar is less than 100 milligram per deciliter, then 45 to 60 gram of carbohydrate can be added. If it is 100 to 180, then 25 to 50 gram. And if it is 180 to 300, it can be 15 gram can be added. So depending upon all these things, you have to understand. Or if the intensity is a varying intensity, and if the time duration is longer, maybe say half an hour to 1 day, or half a day to 1 day, then insulin may base be decrease. You have to decrease the insulin, and the decrease in conservatively estimate the decrease in insulin peaking at the time of activity by 10%. So one has to, and 50% reduction uh, is not common. I mean, you have to understand this. Increase carbohydrate before, during, and after activity, like 10 to 50 gram carbohydrate per hour, as a diluted, fruit juice may be there. But the rule of thumb is you can incorporate always, 20 to 50, 15 gram to 30 gram of carbohydrate at the onset, or every half an hour of exercise, vigorous intensity exercise. This is what, in order to prevent, the possibility of the hypoglycemia. This is what you have to understand. Then going into the possibility of the hyperglycemia, we already know that the exercise, high intensity exercise may causes hyperglycemia because of the different counter regulatory hormone. This is the exercise which was done at 65% VO2 3-hour cycling. You can see that all counter regulatory hormone, it may be epinephrine, it may be norepinephrine, it may be glucagon, maybe the cortisol. Also short time here, you can see that they all increases in order to maintain the blood sugar. This is for a normal person. And here again, for a normal person, if the cycling was done as 65 to 70% of the VO2 max, you can see that the blood glucose is relatively maintained, whereas insulin keep on decreases. So this is the basically done by the body in order to maintain the blood glucose level. So the physiological reaction to exercise one has to understand. For example, for aerobic or endurance moderate intensity exercise, then primary fuel may be glucose or fatty acid, and the change in glucagon and insulin ratio, is the main factor, increasing the fuel production, and insulin, production may be decreases here. But in case of the high intensity exercise like anaerobic exercise like sprint exercise, the primary fuel is always, most of the time, is always glucose, and there may be 14 to 18 times increase in catecholamines, may, norepinephrine and epinephrine may be increased, and the insulin, may remain the same during exercise and increase after, after exercise, it may increase, but during exercise it may be there. So that's why during the exercise, in case of the high intensity exercise, there is always risk of the hyperglycemia and ketosis even. So one has to understand this concept, and that's why you have to design your exercise prescription of the diabetic. Like for example, aerobic training can be given at a frequency of 3 to 7 days per week. Resistance training can be given equal to more than 2 days, that 2 days per week, non consecutive days, non consecutive days, preferably 3 times a week. And a flexibility training can be done for say equal to more than 2 to 3 times per week. Intensity for aerobic training you can keep at 40 to 59% of VO2R, that is VO2 reserve, or say 11 or 12 RPE, that is a rating of percent exertion, to 60 to 89% of VO2R, or 14 to 17 RPE. Or resistance training, you can give the resistance training from intensity of the 50 to 69% of 1 RM up to 70 to 85% of 1 RM. And flexibility, you always has to give flexibility to the point of tightness and slight discomfort, but not to the point of the pain. And in case of the type 1 diabetes, the duration of the exercise can be kept around 150 minutes per week, at moderate intensity of the exercise, or 75 minutes per week at vigorous intensity of exercise, or combination of the both. For type 2 diabetic, the same 150 per week per minute of moderate intensity, or you can increase up to the vigorous intensity. For resistance training, it's always better to give 8 to 10 different exercise for 1 to 3 set. The repetition can be 10 to 15 repetition to near fatigue per set, and you can slowly progress to heavier weight of 1 to 3 set of 8 to 10 repetition. For flexibility, always hold, the if you are doing static stretching, then hold for 10 to 30 seconds, and you can do 2 to 4 repetition. And stretching, you can do the static stretching, dynamic stretching, PNF, or progressive neuromuscular facilitation stretching. And for resistance training, free weight you can do by using different resistance machine. You can use for aerobic, walking, cycling, swimming, and different type of regime you can use. But the one point which you have to remember always is the preferable, blood sugar is 120 to 180 milligram per deciliter. You have to modify the exercise dose, and the rule of thumb for giving carbohydrate is 20 or 15 to 30 gram at the onset and every half an hour of vigorous intensity of exercise. And it's always better to avoid exercise if the blood sugar is more than 200 to 250 milligram per deciliter with urine ketone. And if it is 300, more than 300, it's always better, irrespective of whether ketone present or not, you have to avoid the exercise. And for the players, as far as HbA1c is concerned, we generally prefer the player to have HbA1c of less than 7%. And for adolescent, it may be up to 7.5%, less than 7.5%. So this also you have to understand. So going ahead with the different, exercise exercise prescription, especially for strength and diabetes is concerned. As we all know that the strength, there is after the age 40 years, in case of the normal person, there is reduction in skeletal muscle mass by 3 to 8% per decade. And it is more in case of the type 2 diabetic also. Here you can see that this is the 40-year-old triathlete. See, you can see the amount of the skeletal muscle in his thigh MRI picture. But here in this 74-year-old sedentary person, adipocyte tissue is so much, and the lean muscle or muscle mass is so less. And if you compare to the 70-year-old triathlete, see exercise, and because of the exercise, his muscle mass is maintained, relatively maintained. And why muscle mass is important? Because if you see here, this is the glucose uptake in this graph. If you see the athlete and non-athlete for younger and older also, they are relatively same. Even if older also, they are relatively same. That means is the effect of the negative effect of the ACE on glucose uptake can be countered up to certain extent by doing exercise, by incorporating exercise. This is the importance of exercise. Like for example, normal weight also, if you see, there is a relatively a same between a younger and older person as far as glucose uptake is concerned. In the same way, for obese also, for younger and the older, they are relatively same. But the obese, uh, that's why the importance of the strength training, importance of the exercise is shown by this graph. Even if it is somewhat countering the negative effect of increasing age. So you have to keep on adding for elderly population who are more risk of having sarcopenia and sarcopenic obesity. You have to add different easily doable different balance and strength, not only strengthening but also balance exercise also, especially for diabetic. Here you can see that by incorporating 6 weeks of balance and resistance training, the risk of fall decrease significantly in case of the type 2 diabetic. And the different simple doable different exercise can be like a single leg stand, single leg raise, toe and heel raise, toe towel grab, cushion stand, change position stand, sit to stand, or heel to toe walk or backward walk. These are the simple easily doable different things which are important as far as the balance and proprioceptive exercise is concerned. And for strength training, basic strength training, like here you can see that sit to stand by using a simple chair, you can do. And you can incorporate yoga, the different yoga based lifestyle intervention, or tai chi, the activity, or for example different other different balance and proprioceptive exercise based upon the smart goal, where which has to be specific, measurable, attainable, realistic, and time bound. So depending upon that, you can incorporate different component, and hence it will be more effective. And apart from that, you should also consider reduction in the sedentary activity also. Like sedentary activity, you have to give a breaking sedentary time should be break even every say 20 to 30 minutes, and by using activity break, exercise break, or exercise snacking has to be done. And you have to increase other physical activity, not only exercise, like they are the spontaneous physical activity, spa, or non-exercise physical activity, leisure time physical activity. This you have to increase, like you can park your car longer duration, from your place of work, or you can prefer walking the stair, or you can go always prefer to have a walking or cycling as compared to driving a car, or going in automobiles. So by incorporating the simple stuff, you can easily achieve the target of improving more physical activity, improving more physical fitness in your diabetic patient. You have to remember, as far as MET is concerned, that is, you have to avoid a sedentary. Sedentary activity means 1.5 equal to or less than 1.5 MET. MET is the metabolic equivalent for tasks. By definition, sedentary activity is any activity which has MET of equal to or less than 1.5. And standing, simple standing is approximately the amount of the energy consumption in standing is equal to or more than 1.5. That means if you are doing standing, then you are not doing, you are decreasing the level of your sedentary activity also. So if even if you are not doing anything, just stand, just try to stand, try to do your work by just simply standing, and doing some isometric exercise of your isotonic exercise while being standing. So this you have to understand. Next, going to the the different physical activity, not only exercise. You have to improve. You have to increase any physical activity. Like for example, here you can see that this is the glucose level, and if you see that this was done in 24 adult type 2 diabetes, mean 62 years, and a postprandial. This is the postprandial blood sugar, and you can see that just by adding 3-minute light walking or simple resistance exercise activity every 30 minutes, you can see that there is the blood glucose level is significantly reduced. That is, the blood glucose profile is improved. Blood glucose level is improved if you add simple 3-minute walking or simple resistance exercise every 3 minutes. In the same way, this was basically reported by there is in published in 2011. Here you can see that just after eating, if you do brisk working, just after eating, what is the changes in the blood sugar level? This is what the authors has reported. So this basically shows the changes in the blood sugar after a meal without any walking here. Just after a meal, that is BS0. This is 0 means just after a meal, and 30 minutes 30 minutes after starting walking. And same similarity, if you see here, if you incorporate this 30 minutes of the brisk walking just after the meal, then you can see that there is a reduction in the blood sugar. Reduction of blood sugar, postprandial blood sugar reduction. And the author has reported that they have lost weight of around 1.5 to 3 kg over 1 month. With everything remains the same just by doing 30 minutes of brisk walking after meal. So that is important. But one has to remember that if you there should not be any discomfort, fatigue, or stomach pain, etc. If you try to do brisk walking just after exercise, if you are feeling that, then it's always better to avoid. But if you are not feeling any kind, for example, this author has reported that they do not feel any kind of discomfort, fatigue, or stomach ache, and they have successfully incorporated brisk walking immediately after the meal. And this has been shown to affect their blood glucose level also, as well as their significant weight reduction over 1 month also. Another point of which you have to understand is about the timing of the exercise. Timing of the exercise is basically you should do your exercise depending upon your chronotype. What chronotype person you are, whether you are evening chronotype, or morning chronotype, or night owls, or morning uh, you know person, so night person or morning person. Depending upon that, it's better to do exercise. But here this exercise this paper was basically reported in 2019. Here you can see that you can see that this is the red one, is the morning exercise. If you do high intensity exercise in the morning, and they have done high intensity exercise 3 times a week, and this is the continuous blood sugar monitoring for the exercise day. And here you can see that the red one is the morning in the first week, and this is the afternoon blood sugar in the afternoon, and this one, the gray one, is the pre-exercise or pre-training blood sugar. So from this you can see that they have basically given exercise morning around say 7 to 9, around here, or approximately around 8 a.m. or so. They have given this morning exercise. Evening they have basically done the exercise between 15 to 17 hours of the day. And you can see that during the exercise time, the blood sugar was higher in case of the morning exercise as compared to the evening exercise. In the same way, here is the this is the rest day. There is 3 times a week, the rest day, the day in which they are not doing the exercise. Still in the rest day, you can see that as compared to the as compared to the evening post afternoon exercise, the post morning exercise has significantly higher blood glucose. So they have also measured the same thing in case of what you call the third week. And this is the exercise day for the third week. And for the third week, you can see that the blood sugar was significant was higher in case of the morning exercise in the second week, and as compared to the afternoon exercise. The same thing in the second week, when they have done exercise for 3 times per week. for 8 subjects, and you can see that the post morning exercise of high intensity exercise results into significantly higher glucose even in case of the resting day also. So what they have concluded is high intensity exercise. So if so what they have concluded is if you do high intensity exercise like cycling of say 2 weeks, because they have basically done for 2 weeks, 2 weeks, there is three sorry for the mistake, it is 3 days per week. Then evening exercise is more efficacious at improving blood sugar. So this is one has to important. This is not 2 days per, it is 3 days per week. It is 3 days per week, typing mistake. So if you don't have much time, and if you want to do exercise especially for type 2 diabetic, here they are basically done for type 2 diabetic males, they have reported, this author have reported that high intensity exercise in the evening is more efficacious in improving blood sugar as compared to the morning exercise. So this you can incorporate, but it is always better if you take someone type of the chronotype when you are prescribing exercise, the timing of the exercise. Now let's go to the another concept, that is the newly concept, the possibility of the blood flow restricted training, benefit and risks. We already know that resistant training is absolutely important, because resistant training, the goal is the gold standard for increasing muscle mass, and muscle mass is what it is losing after the age of the 30 years because of the old age. And the diabetic, the prevalence of the diabetic is increases with advancing age. So you have to understand that resistant training plays an important role. Resistant training not only increase the blood flow translocation and decrease the risk of the hyperglycemia, but because of relatively high intensity resistant training may, for bricks resistant, high intensity resistant training, they may increase the level of the catecholamine, and hence increased glucose production is there, and therefore hypoglycemia risks also they are countering. So they are countering the risks of the hyperglycemia by increasing blood flow translocation and uptake of the glucose into the muscle. And at the same time, because of the different catecholamine and counter-regulatory hormones, because of the increasing blood glucose level, they are countering the risks of the hyperglycemia also. That's why resistant training is important. And one of the technique for resistant training, here it can be given here, is what is called what is called the blood flow restricted training. Blood flow restricted training is nothing but a band of a band is used in order to restrict the flow of the venous flow, but we are not restricting the arterial flow, we are restricting the venous flow. And by using the blood flow, what we are doing is we are basically restricting the venous flow. And by doing that our the body by doing that our body is there's some technical issue is there. Okay. So by doing that, what is happening is our body is perceiving that lower intensity by using the band uh, uh, as a higher intensity. That means we are using a low intensity, but the body perceive is at a higher intensity, and adaptation will be similar to that what we are normally achieve as a higher, relatively higher intensity. So let me share. Okay. Now, so what is happening is in case of the blood flow restricted training, we can do normally in case of the normal individual, we can do blood flow restricted training at say 20 to 30% of the 1 RM, with a higher, relatively higher repetition, say more than 15 reps, and for a short duration rest period, say less than 1 minute. And for the upper body, we generally use the band, the band at 50% of the AOP. AOP is the nothing but the arterial occlusion pressure. This we have to find out by using ultrasound, Doppler ultrasound, or simply you can use by using the pulse or pulse oximetry also, and different techniques. And for lower body, we generally use 80% of the AOP, that is arterial occlusion pressure. So basically what we are doing is, by using a relatively a lower load and using this occlusion and occluding the venous flow, we are giving adequate stimulus to the body, and the body is confusing it to be a higher stimulus, and adaptation is occurring as if you are doing higher intensity. That means, without actually doing higher intensity, you may be able to get all the benefits in strength and muscular fitness, by simply using blood flow restricted training with lower load. This is the important. And the different theoretical advantage of the blood flow restriction training may be there in type 1 diabetes. Say it improve the glycemic control. We already see that there is increase, insulin sensitivity is there, blood flow translocation is there, increasing muscle mass. The blood flow, majority of the 80% of the blood flow may be present in the skeletal muscle, and if you increase the muscle mass, then you are creating more sink for blood glucose. In presence of insulin, more blood glucose can enter into increase muscle mass, and they may counter the sarcopenic effect of the aging. So independent of the aging, by adding resistance training, there will be increased muscle mass. And strength training is important, because strength, if your strength is increased, then you will be able to do all the leisure time physical activity, and all your quality of life improvement will be there. There will be reduction in more morbidity and mortality also. There is also improvement in aerobic capacity also, because strength training has a additive, has a effect on the aerobic training also. And strength incorporation of the strength training along with aerobic training will improve the aerobic capacity. And there is because of all these things, there is a reduction in systemic inflammation also. Low grade inflammation is the major cause of lots of cardiovascular and other metabolic endothelial problem. So if low decreased systemic inflammation is decreased, then the other complication of diabetes may be decreased. So cardiovascular risk factor may be decreased. So all this, ultimately lead to the reduction in morbidity and mortality in case of diabetic, and blood flow restricted training may be helpful in case of the diabetic. But one, you must understand that because you are using tourniquet, you are using vein, and which is restricting the blood flow of the venous blood flow. That's why you have to consider the risks and benefit risks to benefit ratio also. Like diabetes, they are mostly prone with endothelial dysfunction, varicosity may be there, and other problem may be there. So you have to be very careful when you are using blood flow restricted training. The risk and benefit ratio you have to understand while using this form of training. And going into the kinesiotherapy, one has to understand that type 2 diabetic is associated with lots of musculoskeletal disorder. Like for example, if you see with and without diabetes here, you can see that osteoarthritis, 80%, 18% higher osteoarthritis is present in case of diabetes. Where without diabetes it is only 5%, and frozen shoulder or adhesive capsulitis may be present up to say 11 to 13%, 30% in case of the diabetes. Limited joint mobility may be present up to 50%, 8 to 50%. That's why flexibility training and range of motion training is extremely important. Dubai train contraction may be there up to 63%. Carpal tunnel syndrome may be there up to 16%, or flexor tenosynovitis may be present up to 11%, or diffuse idiopathic skeletal hyper or osteosis may be present up to 49% in case of the diabetes. So skeletal muscle abnormality is highly common in case of diabetes, and you have to use the principle of the exercise therapy and kinesiotherapy in order to target abnormality which are present in skeletal muscle. Like for example, you can use the concept of the muscular imbalance of Janda. You can use this concept like if upper cross syndrome is present in case of the abnormality around the neck region, which may be associated with the weak inhibited and lengthened deep cervical flexor, as well as the weak inhibited lengthening of the lower trapezius serratus anterior. So you can do strengthening of this muscle, and the facilitated or tightened muscle of the say sternocleidomastoid and pectoralis, or the upper trapezius or levator scapulae, you can do stretching of this muscle. So strengthening of this muscle, stretching of this muscle will be beneficial. Like similarly, in case of the lower cross syndrome, around the lower back, there may be inhibited, and weakened abdominal as well as gluteus medius, minimus, and maximus, whereas tightening of the rectus femoris or iliopsoas muscle may be there, as well as thoracolumbar extension muscle. So stretching of this muscle facilitate the tighten muscle, as well as strengthening of the weak muscle will help in countering this muscle imbalance. But one has to remember that muscle imbalance as proposed agenda may not be present practically, so you have to understand this. But one point which everyone should know is that exercise is definitely useful, and mechanotransaction is one of the mechanism for exercise where healing occurs. Like for example, here if you see that for heel drop exercise here, there causes sliding of the collagen, and the sliding of the collagen will increase the intercellular communication via gap junction, and also communication with the nucleus of the cell, and this will ultimately to the upregulation of the protein synthesis and healing, repair of regeneration of that particular this thing will happen. Not only repair, but regeneration, healing. So that is the importance of exercise. So not only different exercise like here there is the this is the heel drop exercise, Alfredson heel drop exercise for different tendinopathy, or for example for patellar tendinopathy, you can use the decline squatting for just in the form of the eccentric training, or you can use what you call a Copenhagen eccentric strengthening for adductor muscle. So all this follows the principle of the what you call the mechanotransaction, and depending upon your the problem which is already musculoskeletal problem there, you have to design a particular rehabilitation which you have to target. Like first you have to target muscle conditioning by targeting motor activation, re-education, strength, power, endurance, and then flexibility, range of motion exercise, neuromuscular control like proprioception exercise and balance exercise, then some functional exercise you have to keep on adding. And if a particular person is a player, then you can add the sports skill, and then you have to see if there is any biomechanical abnormalities present or not. If it is present, then correction of the biomechanical abnormality and addition of the fitness and psychological training has to be done. And not only for the muscle, but also for nerve exercise are also there, especially for diabetes where the peripheral neuropathy may be there. And different nerve stretching, flossing, slider, and tensioner technique can be used effectively. Like for example, for upper limb, you can see this is the basically he is doing the radial nerve, he is targeting the radial nerve here. And this is the what he is doing is basically the median nerve. And by bending the elbow, what he is doing, he is targeting the ulnar nerve. So by using different technique, you can target different peripheral nerve. And here similarly for what you call the lower limb also, you can do a different neural stretching technique. Lower limb neural stretching technique, it may be modified Thomas stretching or slum stretching, or different other technique can be used in order to relieve the irritability of the peripheral nerve, and this will also benefit different diabetic neuropathy, peripheral neuropathy also. So and before going further, I would like to point certain conditions, certain conflicting with diabetic medicine with different exercise. Like for example, exercise is absolutely important for diabetes. Weight loss may or may not be there with exercise. One has to remember, for weight loss, diet, lifestyle and diet is important. Exercise is for fitness. Exercise is for increasing fitness. It will improve body composition, but for weight loss it may not be so much significant for weight loss as compared to diet. This one has to remember. For VO2 max, exercise will increase in diabetes. Fasting blood sugar control is there. It doesn't cause us increase. Postprandial HbA1c, there is reduction. There is glycemic control is good with exercise. fasting exercise, fat use, there is increase, fat utilization by exercise training. Insulin stimulated, glucose uptake is increased by exercise, and blood pressure may be decreased, cholesterol, especially triglyceride, it is decreased, free fatty acid may or may not be there, inflammation is reduced, vascular function is improved, AMPK, kinase activity increase. All this is basically affected by exercise. And the secondary messenger for exercise is, there are lots of secondary messenger which is mediated the beneficial effect exercise. And ROS, healthy production of the muscular, ROS, there is, oxidative oxidant is one of the secondary messenger for exercise mediated beneficial effect. This you have to understand. But what is happening is, if you add metformin, and it may be metformin, it may be statin, it may be, multivitamin supplement like antioxidant like vitamin C, vitamin E, or others, which are potent antioxidant. What they are doing is they are basically targeting the exercise induced ROS production. ROS production may be targeted, and because of this reason, what is happening is the beneficial effect of the exercise may not be there if you combine exercise with metformin, like for metformin, or it may be statin, or it may be vitamin C, or like that. Like for example, if we know that what metformin may causes weight loss, and no problem here. For example, VO2 max. Increase in aerobic fitness is there with exercise. Metformin may or may not, but if you combine with exercise with metformin, then what will happen? The aerobic fitness may or may not be there. Improvement may or may not be there, because metformin is basically interfering with the secondary messenger for exercise. Similarly, for example, here also postprandial glucose or HbA1c, which is reduced by metformin as well as exercise, they are independently acting. Their secondary messenger is different. For metformin, it is different. For exercise, it is different. But when you combine both, then it may decrease or it may remains the same. In the same way, for fasting exercise fat utilization, metformin doesn't have any kind of the effect, but exercise will increase the utilization of the fat. But when you combine exercise with metformin, then what is happening is they may remain the same also. So similarly, all this thing can happen. The point to be remember is, if you have to add metformin along with exercise, then you have to be very careful. The dosing, especially statin and all that stuff, which will which has causes musculoskeletal problem, and the mitochondrial problem. So you have to understand before prescribing metformin, statin, and other supplement, especially strong antioxidant supplement, because one of the mechanism for the good effect of exercise is by production of the ROS. And if you obstruct this production, then the beneficial effect of the exercise may not be there. So this you have to understand. So I am reaching the end. The final point which I want to say, that physical activity, exercise, and positive lifestyle is extremely important for positive physiological adaptation and health benefit, which is translated into performance, fitness, and health. And especially for type 2 diabetic, it is extremely important. The fitness exercise not only prevent the development of the diabetes, but also for already diabetic, they help in prevention of the complication of diabetes, as well as decrease morbidity and mortality. And regarding the combination of there are so many different effect of the of exercise, like improvement of the vascular function, inflammation, reduction in inflammation, correcting the dyslipidemia, or reducing the hypertension, increasing the aerobic fitness, and the good glycemic control. All these things is affected by insulin exercise. And you have to understand how to prescribe properly exercise by following different principle of the exercise prescription, so that ultimately, for those who are having diabetes also, there is they may increase quality and to their life and prolong their lifespan. and by reducing all the complications. Thank you very much.